Good day, everyone, especially to our professor, Mrs. Nerissa M. Beatriz. I was assigned to discuss Chapter 35. It is all about behavioral problems, meaning, concepts, and treatment. In psychology, behavior consists of an organism's external reactions to its environment. Other aspects of psychology, such as emotions, thoughts, and other internal mental processes, don't usually fall under the category of behavior. Behavior may be modified according to positive or negative reinforcements from the organism's environment or according to self-directed intentions. What does problem behavior mean, and when does behavior become a problem? Problem behaviors are those that aren't considered typically acceptable. Nearly everyone can have a moment of disruptive behavior or an error in judgment. However, problem behavior is a consistent pattern. Problem behaviors can vary in terms of severity. They can occur in children as well as in adults. People with problem behaviors often require medical intervention to improve their symptoms. Temper tantrums are a very common behavior problems among children. What are the causes? These are the multiple causes associated with problem behavior. A psychiatric, mental health, or medical professional should evaluate a person with problem behavior to determine the cause. Causes of problem behavior can be a life event or family situation. A person might have a family conflict, struggle with poverty, feel anxious, or have had a death in the family. Aging can also lead to dementia, which affects a person's behavior. So what are some ways on how to correct or fix bad behavior of a child? Number 1, keep calm and carry on. She'll realize her behavior isn't working and move on. Number 2, stay positive. Don't label your kid as bad or difficult. Just stay positive. Practice what you preach. So modeling good behavior is a powerful parenting tool. Another, kids mimic what they see and hear. So just practice what you preach. Do a little detective work. Kids usually act out for a reason, like jealousy or fear. Another, validate those feelings before dishing out discipline. Another way is stay the course. Set and stick to specific consequences for broken rules. Stay the course also. If you're not consistent, you lose authority. Bend, don't break. Don't be afraid to sit. to set new boundaries. The change may cause a backlash, but don't back down. Take a time out. You can't always be a rule monger. Take time to relax and celebrate good behavior. When do I seek medical help for problem behavior? So number 1, contemplating suicide. Number 2, harming oneself or another. Number 3, threats of violence. Another, behavior that affects the ability to function in relationship with others in the workplace or at the school. Another is criminal behavior, engaging in intimidating, bullying, or impulsive behaviors. Excessive feelings of isolation, low interest in school or work, social withdrawal. How is problem behavior treated? Doctors treat problem behavior by diagnosing its causes. People who are at risk for harming themselves may require an inpatient stay at the hospital for their personal safety. So these are the following treatment: conflict resolution classes, counseling, group therapy, medications, and parenting skills classes. Another problem behavior is the passive-aggressive behavior. People with passive-aggressive behavior expresses their negative feelings subtly through their actions instead of handling them directly. This creates a separation between what they say and what they do. For example, say someone proposes a plan at work. A person with passive-aggressive behavior may oppose the plan, but instead of voicing their opinion, they say that they agree with it, since they are actually against the plan. However, they resist following it. They may purposely miss these deadlines, turn up late to meetings, and undermine the plan in other ways. So here's another example. A woman is studying with her boyfriend in the same room. She is upset with him, but instead of telling him that she is mad at him, she blasts the music on their laptop to bother him. So that's the passive-aggressive behavior. So what are the common signs of the passive-aggressive behavior? So we have 4. Number 1 is bitterness and hostility toward other people's requests. Number 2, intentionally delaying or making mistakes when dealing with other people's requests. Number 3, having a cynical, pessimistic, or aggressive demeanor. Number 4, frequently complaining about feeling underappreciated or deceived. So what are the causes? What are the causes of the passive-aggressive behavior? So the exact cause of passive-aggressive behavior isn't known. However, both biological and environmental factors may contribute to the development of passive-aggressive behavior. Researchers believe people who exhibit passive-aggressive behaviors begin doing so in childhood. Parenting style, family dynamics, and other childhood influences may be contributing factors. Child abuse, neglect, and harsh punishments can also cause a person to develop passive-aggressive behaviors. Substance abuse and low self-esteem are also thought to lead to this type of behavior. So how is passive-aggressive behavior treated? You may be referred to a therapist or other mental health professional for counseling. A therapist can help you identify passive-aggressive behavior and teach you how to change your behavior. Assertiveness training can also help to manage the passive-aggressive behavior. So these courses teach them how to express their thoughts and concerns effectively. This can help reduce negative behaviors caused by underlying anger and frustration. So what are the ways to eliminate passive-aggressive behavior? So there are 6 ways. Number 1, being aware of your behavior. Number 2, identifying possible reasons. Number 3, thinking clearly before you act. Number 4, staying optimistic. Number 5, expressing your feelings in a healthy way. And number 6, taking a break before reacting to situations that make you upset. So another problem behavior is the aggressive behavior. So what do we mean by aggressive behavior? Aggressive behavior can cause physical or emotional harm to others. It may range from verbal abuse to physical abuse. It can also involve harming personal property. It violates social boundaries. It can lead to breakdowns in your relationships. It can be obvious or secretive. Occasional aggressive outbursts are common and even normal in the right circumstances. However, you should speak to your doctor if you experience aggressive behavior frequently or in patterns. When you engage in aggressive behavior, you may feel irritable and restless. You may feel impulsive. You may find it hard to control your behavior. You might not know which behavior are socially appropriate. In other cases, you might act aggressively on purpose. For example, you may use aggressive behavior to get revenge or provoke someone. So you may also direct aggressive behavior towards yourself. So what are the health causes of aggressive behavior? So number 1 is the autism spectrum disorder. Another is the ADHD or the attention deficit hyperactivity disorder. Number 3, bipolar disorder. Next is conduct disorder, intermittent explosive disorder, and lastly, the post-traumatic stress disorder or the PTSD. What are the causes of the aggressive behavior in children? Sometimes children lash out due to fear or suspicion. This is common if your child has schizophrenia, paranoia, or other forms of psychosis. So if they have bipolar disorder, they might act aggressively during the manic phase of their condition. If they have depression, they might act aggressively when they feel irritated. Your child might also aggressively when they have trouble coping with their emotions. Children with ADHD or other disruptive disorders may show a lack of attention or understanding. They may also appear impulsive. In some cases, these behaviors may be considered aggressive. This is especially true in situations when their behavior are socially unacceptable. So what are the causes in teenagers? Puberty can also be a stressful time for many teens if they don't understand or know how to cope with changes during puberty. Your teen may act aggressively. If they have mental health condition, it can also contribute to aggressive behavior. So aggressive behavior in teenagers is common. So for example, many teens act rudely, or get into agreement sometimes. So however, they might have a problem with aggressive behavior if they regularly yell during arguments, get into fights, bully others, stress, peer pressure, substance abuse, and unhealthy relationship with family members or others. How is aggressive behavior treated? It may help to talk to someone about experiences that make you feel aggressive. In some cases, you can learn how to avoid frustrating these situations by making changes to your lifestyle or career. You can also develop strategies for coping with frustrating situations. Your doctor may recommend psychotherapy to help treat aggressive behavior. So, cognitive behavioral therapy also can help you learn how to control your behavior. It can help you develop coping mechanisms. It can help you understand the consequences of your action. So, talk therapy is another option. Oppositional defiant disorder. So, what do you mean by ODD, or the oppositional defiant disorder? This is a behavioral disorder that results in defiance and anger against authority. It can affect a person's work, school, and social life. ODD affects between 1 and 16% of school-age children. It's more common in boys than girls. Many children start to show symptoms of ODD between the ages of 6 and 8 years old. So ODD also occurs in adults. Adults with ODD who were not diagnosed as children often go undiagnosed. So what are the symptoms of ODD? We have frequent temper tantrums, refusal to comply with adult requests, actively disregarding, being easily annoyed, vindictiveness, feeling angry at the world, behavior intended to upset, annoy, or anger others, blaming others for their own, identify, identifying as a rebel, feeling misunderstood or disliked. So what are the causes of ODD? There's no proven cause of ODD, but these are theories that can help identify potential causes. It's thought a combination of environmental, biological, and psychological factors cause ODD. One theory suggests ODD can begin to develop when children are toddlers, because children and adolescents with ODD show behaviors fairly typical of toddlers. This theory also suggests that the child or adolescent is struggling to become independent from parental or authority figures they were emotionally attached to. It, it's also possible that ODD developed as a result of learned behaviors, reflecting negative reinforcement methods some authority figures and parents use. This is especially true if the child uses bad behavior to get attention. So in other cases, the child could adopt negative behaviors from a parent. So how oppositional defiant disorder treated? So early treatment is essential for people with ODD. teens and adults with untreated ODD have increased risk for depression and substance abuse, according to the American Academy of Child and Adolescent Psychiatry. Individual cognitive behavioral therapy, a psychologist will work with the child to improve anger management skills, communication skills, impulse, control problem social skills. They may also be able to identify potential contributing factors. Another behavior problems is the sociopath. This is a term used to describe someone who has antisocial personality disorder or the ASPD. People with ASPD can't understand others' feelings. They often break rules or make impulsive decisions without feeling guilty for the harm they cause. People with ASPD may also use mind games to control friends, family members, co-workers, and even strangers. They may also be perceived as charismatic or charming. What is the difference between a sociopath and psychopath? A sociopath may be someone who only makes minor transgressions that don't cause serious harm or distress. But a sociopath may be someone who only makes minor transgressions, but a psychopath may be described as someone who's physically violent or put others in danger. However, when one considers the DSM-5 diagnostic criteria, all of these symptoms can be found in ASPD category. What are the common signs of ASPD? Number 1, they doesn't respect social norms or laws. They consistently break laws or overstep social boundaries. Number 2, they lies, deceive others, uses false identities or nicknames, and uses others for personal gain. Doesn't make any long-term plans. They also often behave without thinking of consequences. They show aggressive or aggravated behavior. They consistently get into fights or physically harm others. What are the possible treatment for ASPD? So number 1 is the psychotherapy. Consists of talking with a therapist or counselor about thoughts and feelings that can exacerbate ASPD behaviors. It may also include management therapy for anger, violent behavior, and addiction to drugs or control. Cognitive behavioral therapy helps you think more carefully about reactions and responses to people and situations. CBT won't cure ASPD, but it can help develop positive, less harmful behaviors. CBT can also help you accept that you have the disorder and encourage you to be proactive in addressing your behaviors. So, there's no specific medication for the treatment of ASPD. You may receive medications for associated mental disorders, though, like anxiety, depression, and aggressive behavior. So, the medication, clozapine, or the Clozaril, has shown some promise trusted source as a treatment for men with ASPD. So before I end my topic, may I read to you the quotation from Bo Sanchez. Never focus on your problems. Focus on your possibilities. The problems will pull you down The possibilities will push you up. Thank you very much for listening.